Today in this pregnancy ultrasound video we will discuss about fetal biometry parameters. So in this video you can see this is a fetal skull biparietal diameter, this is a femur length, which are two important parameters used in fetal biometry to estimate the gestational age and fetal weight. Biparietal diameter is a key measurement taken during the obstetric ultrasound, particularly in the second trimester of pregnancy. Biparietal diameter is a distance between two sides of fetal head from one parietal bone to second. We measure it from one parietal bone from we measure it from one parietal bone outer edge to the inner edge of other parietal bone. We measure biparietal diameter when the fetal skull bone are symmetrical, forks cerebri should be centrally placed, and thalami should be on the either symmetrical side. Now we are going to show you how to measure the biparietal diameter from the inner edge to outer or outer edge to inner. So result came 52 mm, 21 week, 6 days. So when we talk about the measurement, 23 mm shows 13th week gestational age, 34 mm 16 week, 46 mm shows 20 weeks, 60 mm shows 24 weeks, 75 mm shows 28 weeks, 85 mm shows 32 weeks, 90 mm shows 36 weeks. Second parameter is femur length. So this is how we measure femur length. So the results came 42 mm measures 23 week 6 days. In this image, when we talk about the placenta is posteriorly lying. Placenta can be interior, that can be posterior, or covering the internal os, that is labeled as placenta previa. Third parameter used in fetal biometry after the second trimester is abdominal circumference.